I feel like I should suck in my gut right about now. Guys, are you getting a little bit of a spare tire? Ladies, are you looking to maybe drop some sizes in the abdomen without setting foot in a gym, without changing your diet? Well, guess what? Board-certified dermatologist Dr. Melanie Palm is here now. And Dr. Melanie, this is some game-changing painless, that's the key for me, painless technology that melts your fat cells. Good morning to you, first of all.
Good morning.
What is this? This is something called Vanquish.
It is.
What is that and how does it work?
It's a Vanquish by BTL, and it's a radio frequency device. So basically that's a special form of electricity, and it's tuned specifically to concentrate the energy at the fat level, and actually heats up your fat cells and permanently destroys some of them, and that's how we get weight reduction.
Now, where did this technology come from? How long has it been around?
It's actually from Europe. So it comes out of Prague. It's FDA approved for deep tissue heating, and right now the FDA is further evaluating final studies for use in fat removal.
There's so many types of non-invasive fat loss treatments out there. How do you pick? You have so much to choose from. How do you decide to go with something like this for your particular practice?
Sure. Well, you know, I perform liposculpture as well, and it's pretty invasive, so I think I get a request frequently from male patients and female to do something non-invasive. I think what makes this distinct is there's no pain. There's no downtime at all from it. Some of the other procedures, you know, you may have heard of cryolipolysis, that can cause a little bit of discomfort, and it's huge. It's actually the largest surface area that treats this non-invasively.
Now, in terms of liposculpting, you said, how does the effectiveness compare to that?
Sure. Well, I tell patients this isn't a substitute for liposculpture if you need larger volumes removed, but if you're somebody like Rian over here who's near his ideal weight but maybe has a stubborn little spot that he can't get rid of, you're close to sort of ideal weight, this will help get rid of those last couple of inches.
So you would think, is this something that's good for men and for women?
Absolutely, both. And I think, you know, men being interested in cosmetic procedures, it's increasing, and so to be able to walk in and walk out in 30 minutes for a procedure, this is fantastic.
Okay, you mentioned this isn't for somebody who may need the liposuction. So the best candidates would be
somebody
it's just
adult,
that stubborn something.
Yeah, who's not interested at surgery at this point, but just has a few pounds sort of around the midsection.
Sure. Okay, so did you say he's a trainer?
He is.
Because I was going to say, dude walked in and he's like a big, strong guy. I'm like, what do you need that thing for? But apparently he comes to you because there's some things that just can't. Okay, what was your name again?
Rian.
Okay, Rian. So you comfortable?
Yeah.
What does that feel like to you? Do you feel, is there heat? Is there any?
It's like a warm blanket.
It's like a warm blanket?
Yeah.
And have you done it before?
Nope.
This is the first time. So you think are you pretty confident in its ability and that maybe kind of, do you have some stubborn spots that maybe this will help you with?
I'm sure everybody does, yeah.
Are you Australian?
No, South African.
South African.
I know.
See,
Good accent, isn't it?
He was laying down. Had he been standing up, I would have.
Yeah.
I was going to say, is that a Mississippi accent? No.
Yeah.
It's South African. Well, welcome. So there's no pain.
No pain. Just it feels like having a heating pad over the area. 30-minute treatment. We even provide a fan if you're a little bit warm. So very simple. It's one of those procedures that almost seems too good to be true, but there's good animal research and human research to demonstrate its efficacy.
Why are you getting this done?
Why?
What's the reason?
You know, people like it.
True. We had some pictures we wanted to show you, Dr. Melanie. Can we bring those up of men and women? This is the guy. Let's hope this is the guy, first of all.
Not me.
Not you. So kind of give us a comparison here.
Sure. So these are from European patients where it's already been under clinical trials. And so you can see that midsection. So this actually treats not only the abdomen, but the flanks, what we call the love handles. And you can see the before and after. It's actually two different patients. And there's usually, in this study, there was an average of about 2¼ inches of reduction in the waistline.
Really?
And in animal studies, it actually showed 60% decrease in the number of fat cells. And
we
think it's permanent.
Is this kind of like the future of
it
this
is.
kind of, you think so?
I really think it's going to be a game changer as far as fat loss and body contouring non-invasively.
All right, we have a picture of a female patient. Can we bring that photo up and see how? Okay, so we have two different people.
Sure.
Here?
Yeah.
Explain what we're looking at here.
And see, these are good ideal candidates. They're people that are close to their ideal weight, but they have that stubborn little bulge in the midsection that they're wanting to address. So you can see in the before and afters, they're just a little bit more nipped in. Some of that area of fat is a little bit better contoured. Their tummy is a little bit flatter.
Amazing technology. And by the way, he's been laying here for about half an hour now, and that's about the duration of the treatment.
Exactly.
So he's about done.
Yeah, usually.
And is it every week? Is it every month? How often do you have to do it?
It's once a week for 4 sessions is what the clinical studies were based off of.
Wow. Fascinating stuff.
I know, it's really great.
Well, if you have dieted and exercised and still frustrated by stubborn pockets of fat around the belly, thighs, or arms, we have some new information for you.
Yes, there are new trends, 2 of them, in defeating that fat. First, using heat to melt it, or using extreme cold to freeze it. Medical reporter Christy Myers looks at both methods, starting with what's called melting the fat.
Right now, right in this area in my abdomen, it doesn't matter how much I work out, how much cardio I do.
Exercise and diet didn't erase her love handle, so Angel Crawford chose heat.
I love that it's much better than all of the sit-ups.
The treatment is pretty simple. It's basically heat from radio frequency, and on occasion there may be a hot spot. It's called the Vanquish treatment, and the goal is to heat the fat cells to 120 degrees.
Which is a temperature that's hot enough to help permanently destroy those fat cells, but her skin temperature really is never going to go above about 100, 101 degrees.
I saw the most difference around here, my waist, and also my little pooch right here.
Lori Reyna had 4 treatments around her stomach.
They worked for me. It did reduce some inches off my waist. My jeans fit me so much better.
In theory, this is a very attractive way to melt fat, if you will, and not harm the overlying skin.
Plastic surgeon John Lamonaco says this and other new fat-reducing technologies may be FDA approved, but need more medical studies to prove they work. This is Angel Crawford again, 6 weeks and 4 treatments later.
And I've lost an additional like 2.5 inches in my waist, so the pants are bigger. Definitely gonna have to go get those taken in. And overall, I love it.
Vanquish treatments cost $2,600 for 4 30-minute sessions. Christy Myers, 13 Health Check.
Welcome to the Fox 19 Business Spotlight, where every day we highlight local tri-state businesses who can make your life better.
Welcome to the Fox 19 Business Spotlight. I'm Wayne Young. Joining me in the spotlight today is Dr. Shalini Gupta, Medical Director at the Dermatology Laser and Vein Center. Doctor, welcome back.
Well, thank you for having me.
In the past, we've talked about your thinking of yourself as more of an artist than a surgeon. That's really true, isn't it?
Yes, and it's true. I do think of myself more of an artist, of course, with the medical background, the knowledge, and everything that goes along with that. But truly, it's not just about performing a procedure, but artistically applying the skill to that procedure, which comes with years of practice, experience, and having an artistic eye.
Mm-hmm. And that obviously is something that's very important to your patients.
It is, absolutely.
One of the things that's very hot in your business right now is called the Vanquish procedure, which actually offers permanent fat reduction with no pain and no recovery time. It seems almost too good to be true.
Absolutely. It does sound too good to be true, but it really works. And it actually uses radio frequency energy along with electromagnetic energy to drive that radio frequency heat directly at the fat cells, and it kills them. So it's much like having liposuction, but without any recovery time, and there is no pain with this procedure, which is different from some of the other technologies we have that also kill fat cells permanently.
Treatment claims to zap away fat with no pain at all.
Losing weight is a very popular New Year's resolution. Maybe it's one you made. So I'm going to get in shape this year. CBS News 8's Alicia Summers is live in La Jolla with the pros and cons of getting rid of fat with, well, one method. What do you think, Alicia? Good morning.
Good morning, Dan and Michelle. That's right. A lot of people are jumping on that fat loss bandwagon train for the new year. So we are talking about reducing fat, destroying fat cells, losing inches off your waist. We're in La Jolla now, where there is just many options for especially non-invasive treatments to get rid of the fat. You could freeze your fat. There's radio waves. You can also do laser lipo. There's a whole bunch of options. So Dr. Roy David is joining us to talk about this brand new machine that Allie is lying in right now. She just wrapped up her treatment. This machine is called Vanquish. How does it work?
Right. So this is a radio frequency device, and this is really ideal for those clients who do not want to undergo liposuction, but they may have some trouble spots they just can't fix with exercise. So the beauty of this machine is that it's completely pain-free. And as you can see, it treats the entire core, so it treats their entire abdomen and their flanks in one 30-minute session.
Okay, so this is Allie's third session. You just finished. It's about 30 minutes. How did it go? How did it feel?
It went great. I barely felt anything.
And it doesn't even touch you, so no pain whatsoever?
No pain at all.
But is it like a little warm?
It's a tiny bit warm, but I could fall asleep right now.
All right. So how many inches have you lost since this is your third treatment?
I believe about 1 or 2.
Okay, so you still have 3 more to go. That's the average amount of treatments for an average client, correct?
Right. So typically, patients will do 4 to 6 sessions, and they can expect to lose anywhere between 2 to 6 inches on average, with some people losing significantly more.
Okay, what are the side effects?
That's the other nice thing about this device. There really are no side effects. So again, unlike invasive procedures like liposuction, there's really no healing, there's no downtime. They get right back to work, and we have seen really no significant side effects whatsoever with this.
Yeah, it sounds too good to be true, but there are some drawbacks. This isn't for everyone.
Right. Again, it's ideal for people who are basically in good shape but just have these trouble spots, and I think we all have them, you know, in the stomach or the love handles.
So it really destroys the fat cells, and then you drink a lot of water, it flushes out of your system. And if Scott could turn around, you could see a before and after picture of a patient who had one of these Vanquish treatments, and that's about, what, 6 sessions?
Right.
Okay, and what's the cost before we have to let you go?
So cost can be anywhere between $2,000 to $3,000 for a full package of treatments.
Okay, so $3,000 for an average of about 3 inches off your waistline. So I know a lot of people out there will say, yes, totally worth it. But again, this is a very new machine. It's been on the market for about 6 months, so not a lot of data is out there yet. So just a disclaimer for you thinking about getting one of these treatments.
Interesting. And I'm sorry, somebody was talking to my ear, and I don't know if you were answering this question or not. So Dr. David said it'll take about 2 to 6 inches off. How soon before you see those results? Is it right away, or do you have to wait a couple days?
No. It's not right away, Allie. You don't see the inches come off right away. It takes a little while because the fat cells have to flush out of your system, right? So how many days did it take you before you really noticed that inch loss?
It's probably after the 2nd session. I noticed a slight difference. I could tell a little bit. But yeah, you see the most results after you finish your 6th session.
Yeah, so you see the loss in about a week.
Okay.
You do it once a week.
Interesting.
All right. Another
Alicia.
option for people out there
No kidding.
that want to try it. There they go.
There you go. New Year's resolutions, here you come.
All right.
Sounds good. Thanks, Alicia.
Welcome back to Studio 10.
Thank you all so much for joining us this morning. Now, we all have the tendency to eat a little more during the holidays. I mean, when you have 3 different desserts to choose from, it's so hard to choose just one. And how can you resist sweet potato casserole? Well, if you've been eating a little less than healthy lately, listen to this. Dr. Bender is offering a new procedure at Gulf Coast Dermatology that may be able to take inches off your waist without any surgery.
We have a new procedure called the Vanquish that actually is non-invasive. There's no pain, there's no downtime. You walk out of the clinic, you can do whatever your heart's desire. It's really exciting. Patients love it. We're one of a few centers across the country to actually have it, and it's targeted radio frequency. So it's improving on radio frequency, which has been around for quite a while. So patients can feel comfortable as far as having the procedure done. It's very safe. But this actually targets the radio frequency in the abdominal area from love handle to love handle. Heats the fat up, thereby getting rid of the fat cell.
So how do you get prepared for this treatment?
Well, the only thing that you need to do is to hydrate. So we tell patients to drink a certain amount of water before the procedure, a day or 2 before, certainly the day of, and a day or 2 after, and that maximizes our results, which obviously we want to do.
Yeah.
And it only requires 4 treatments, and patients come in once every 7 to 10 days. They'll see the best results usually by between week 4 and even a couple weeks after the last treatment.
And you just lay down in this machine and you lay down for about 30 minutes?
About 30 minutes. This is for patients that they're trying their best. They're trying their best to try to eat right. So of course we all have that Thanksgiving, Christmas thing that we have to do.
You cheat a little.
They're trying to exercise, but despite their best efforts, a little bit of abdominal fat, maybe some love handles, and no matter what they do, they just can't get rid of it. That's where this treatment comes in. And so, maybe you've got that pair of jeans that, you can still fit in, but they're just not as comfortable as it used to be.
Yeah.
That's where patients, especially after the first treatment or 2, like, you know what? I can get in those jeans that I just didn't feel comfortable wearing because I gained just a little bit of weight around the midsection. And so it works wonderfully for that.